Alliance. Thanks for joining today. We're very pleased to see so many of you taking time to hear about FIDO's perspective in healthcare. We thought it'd be timely with HIMSS coming up to give you some updates on FIDO and our perspective on key trends in the healthcare marketplace. We have some great speakers today, including Brett McDowell, the Executive Director of FIDO Alliance, and also Tom Groom, the CEO of HealthNexus, who will be sharing some key news and perspectives on how FIDO fits into healthcare settings. First one, housekeeping item. We're happy to take your questions for the webinar today. You can do it in one of two ways. One, you can type questions in the question box or the chat box, and we'll be either responding to those midstream, or if we don't get to them midstream, we'll be sure to answer them at the end of the webinar. We'll also, at the end of the webinar, have open mic Q&A, where you can ask any questions that you may have. To do that, simply raise your hand, if you will, in the GoToWebinar client, and our organizer will take you off mute so you can ask your question. Okay, so with that, let me turn over to Brett McDowell, Executive Director at FIDO Alliance. Brett?
Thanks, Andrew, and thanks everyone for turning out and to hear an update from FIDO Alliance and how things are going and the need for strong customer authentication and FIDO compliance in the healthcare market. So first, let me do a quick overview, recap, introduction of FIDO Alliance. So the FIDO Alliance is a nonprofit organization. We are in an open industry association of over 250 organizations from around the world. We have carefully recruited and developed this coalition of companies, universities, and government agencies to represent both the supply side and the demand side. So we have a very nice balance in the membership to make sure that the requirements that we build our technology to meet are legitimate business and government requirements, and that the solutions have the expertise and the market leaders from information security, usability, and privacy and biometrics, et cetera. So we're very pleased with the coalition that we've built, and we are an open consortium that anyone can join. And I invite you to consider FIDO membership if you think that you would benefit by being involved in our working groups, contributing use cases, contributing designs, and so forth. Now, I want to speak specifically to the scope of work for the FIDO Alliance. We are very tightly focused on authentication. So this is not a general purpose project to address all aspects of identity management and the life cycle, provisioning, deprovisioning. No, we fit into an already rich ecosystem of coalitions and public-private partnerships defining industry best practices and standards for most of identity management. What we are filling is a gap that has been left to previously proprietary implementations, and that is the specific act of authentication. So we're building standards to finally standardize that block in the architecture for identity management. And the way to think about where does FIDO fit in our architecture, where does FIDO fit on my roadmap, just ask yourself, where are the credentials? So think of FIDO as a new technology for a new type of credential. By credential, I mean username and password combinations, mobile number and PIN, PKI certificates, those types of technologies. That's where FIDO fits. FIDO is like a next generation solution to fulfill those use cases, specially designed to improve security. But we think for the first time in our industry's history, with tremendous focus on usability. So FIDO, the first word in FIDO is fast, and that's a key takeaway. FIDO is designed first and foremost for usability, because we've seen other good security technologies come and go because they didn't garner user acceptance. So this is the focus of our scope. Our mission is executed in three phases. So first, we have to develop the technical specifications. We had some milestones to report on this. We published our first public draft of initial FIDO specifications back in 2014. And then at the end of 2014, we were able to deliver FIDO 1.0 final proposed standards in December of 2014. So basically, we've had just over 1 year to see how the market has picked up FIDO technology since we completed the first version of FIDO standards. And we have garnered quite a bit of adoption, which brings me to step 2 of our mission. We developed programs to educate the market around FIDO and how it works. This webinar is one example of many programs that we run. We also have in-person meetings, events called FIDO seminars that we hold around the world, nearly a dozen of those last year. And we also, you'll see FIDO speakers at most of the industry conferences you attend. And soon we'll start having FIDO content at healthcare conferences as we branch out into more verticals. Another program that we have is a partnership program. And I have an update on our partnership program and how we're partnering with trade associations to bring FIDO technology to vertical markets. And the third phase, which I also have an update on, which is formal standardization. So if you're not familiar with how industry standards work, when a coalition like the FIDO Alliance forms and develops technical specifications, that's what we would call a de facto standard. What they produce is something that, it doesn't have, the rule of law behind it. It is from a industry coalition, and a lot of markets, especially government markets, are looking, when they call something a standard, they have a higher bar, and they recognize de jure standards and standards from long-standing consensus organizations differently than they do from industry consortia. So one of those organizations that produces the standards that drive the entire web is the World Wide Web Consortium, or W3C. So very pleased that we have partnered with the W3C, and we have put FIDO 2.0 specifications into the W3C, and they have just formed a new working group and announced a press release, I think it was just last week, that they will have their kickoff meeting of the new web authentication working group and to develop standards for the web platform based on FIDO specifications. And that actually kickoff meeting is next week at RSA Security. So now let me bring it to healthcare before we hear from Tom, who will really explain how FIDO fits in healthcare in more detail. So what is FIDO Alliance doing in healthcare? Well, the first thing is we're bringing strategic stakeholders in the healthcare market into the board of directors of the FIDO Alliance to make sure that we are getting steered in the right direction strategically to deliver solutions that meet the needs of healthcare. So just this week, we announced that Aetna has joined the FIDO Alliance board of directors. And we're anticipating good things, not only from Aetna, but their whole supply chain, their ecosystem of partners and customers influencing the direction of FIDO. The next thing I would announce is tied to what I said before. One of our adoption programs is this liaison program where we sign agreements to collaborate with vertical market trade associations. And one of the first organizations that we signed an agreement with to bring FIDO into healthcare is NHISAC. And this is the organization, like, you may have noticed that FIDO has a lot of membership in the banking and payments area already. And my background happens to be in financial services. So I'll draw the connection to FSISAC, Financial Services ISAC, which does a tremendous amount of work to bring standards adoption and best practices to all of the banking sector and even into payments. So we're anticipating the similar role for NHISAC to play in healthcare, establishing what the standards are, what the industry best practices are, and therefore they're a high priority strategic partner for us, and we're looking forward to doing more work with them in 2016. So with that introduction about FIDO, where we are so far, the standards have been developed and published. There's been a lot of adoption of those standards in the first year that they have been available. I'm going to turn it over now to Tom Groom, CEO of HealthNexus, who is going to speak more. I've been speaking from a FIDO Alliance perspective. He's going to speak from a healthcare perspective and why healthcare needs the FIDO solution. So, Tom?
Thank you, Brett, and thanks to everybody that's joined this morning. First of all, I want to congratulate Brett and team for all the work that FIDO has done in a rather short period of time when you look at it, and also want to thank Aetna for being able to be a thought leader in this opportunity around healthcare as well, and glad that they are part of it. They are an innovative organization. And as the world goes to accountable care, they've done some very interesting components, and FIDO certainly will be an underlying strategic approach for them going forward. So today what I'd like to do is talk a little bit about cyber risk in healthcare. There's stats in pretty much every industry, and I want to start with some basic information that's happening in healthcare. Talk about some of the market trends, and I think everyone will agree with me that the trends that are facing us in healthcare are really supporting the need for FIDO and strong authentication. And then talk a little bit about why FIDO matters. We're going to talk about some of the acronyms in healthcare, which there are a lot of, where government and industry view the direction of where healthcare is going, and then talk about a FIDO-enabled healthcare use case. So let's talk a little bit about the risks. This recent study that was put together identified that healthcare is not suspect to cyber risks. 90% of healthcare organizations have had a data breach, which represents about 120 million lives, which represents about a third of the population has been affected. And there are a variety of breaches. And as we look at the next slide regarding the SurfWatch Cyber Insight, you'll see some of the trending tags in healthcare. What I'm pointing out here is that not every one of these are going to be covered by strong authentication. But as you think of organizations that are trying to protect health information, protective health information, and patient information, what you're going to see is that there are, from a target perspective, it's really focused on patient data, getting that through devices or laptops. From a practice perspective, there's physical theft and just network security breaches. And there's, from an effects perspective, they're getting at specific information that they're trying to get and sell. And I think it's interesting from an actor's perspective, either the unidentified hacker or thief or internal employees, etc. Now, what does this have to do with strong authentication? In healthcare, it's very interesting. I think people have all signed the HIPAA form at some point when you go in to see a physician. And the ability to protect information and the ability to follow state and federal regulations is highly important in healthcare. So when organizations are trying to figure out how they're going to work together to share information, there seems to be some potential barriers there. And there's a lot of time and effort for organizations to contractually figure out not only how to share information, but what are the uses of the information and who ultimately owns the information. And my pose to this group is that having a strong authentication underlying infrastructure will allow where we are in healthcare today to be able to open up the ability to share information, knowing that the person on the other end that's receiving it is who they say they are. So from a market trends perspective, I think it's important to know that healthcare really is everywhere. There's a lot of non-physician care roles that are expanding from a caregiver perspective, and it's certainly going beyond the four walls of the clinic and the hospital. There's a lot of focus on patient engagement, and with that, the different care settings, whether you're in a nursing home, whether you're in assisted living, whether you're at a clinic or you're at home, the ability to have access to information is important. And there's just an interesting stat here that 50% of healthcare will shift from hospitals and clinics to homes and community over the next decade. And I think it's also important to look at, from that perspective, the organizations need to establish, really some billing and tracking protocols to ensure coordination of care activities. And there's going to be an investment that will be needed to link and integrate this data, and to be able to, once they do that, be able to have the ability to share that appropriately. Let's talk a little bit about the use of data and analytics in patient care. Everyone has probably heard of EHRs, electronic health records, that have been incented by the federal government for physicians to not only adopt but to use through meaningful use incentives. And there is going to be a much more increased use of devices and wearables that come into play. The Fitbits of the world, the fitness and wellness and healthcare is a bit at a crossroads. And the idea of patient engagement or measurements, just tracking steps would be a good example, and be able to expand on that to blood pressure and other areas as of great value from a health plan perspective to help go from the Accountable Care or Affordable Care Act, which is really changing from a quantity-based financial model to a quality-based. So preventative health, making the patient more a consumer of health as opposed to listening to the physician, having other resources available to improve their care and to understand the work that they do or the actions that they do day in, day out can support their health going forward. And to do that, collecting and analyzing the data will be very important. Identifying metrics to identify the fact that physicians are taking care amongst their peers by certain categories is going to be of high value. I think the interesting component here, and this has been around for a while, is who owns the data, what's the privacy and the consent issue, and as we're talking about today, what's the security beyond identity proofing? Where is there strong authentication, and where is there user delegation? So from a user delegation perspective, if a mom is helping manage the family, the children, they need to have access to that information. Conversely, as people get older, the sons and daughters are helping out folks that are in nursing homes and in home care and helping their parents. They need to have access to that information. So to be able to do that, there needs to be a strong authentication component in place so that information can be shared and tracked. And obviously, once that information is available, a focus on longitudinal patient data is going to be very important to help get the key insights to improve care. So why does FIDO matter? ONC, again, there's plenty of acronyms in healthcare, is the Office of National Coordinator for Health Information Technology. It falls under the Secretary of Health and Human Services. And they really lead a lot of the IT efforts around the identity to coordinate nationwide efforts to implement and use the most advanced health information technology and exchange of information that's available. And they recently came out with 4 goals that I think that are important that fall very well into the discussion today. Goal number 1 is the advanced person-centered and self-managed healthcare, to be able to help make sure that we become more consumers of our healthcare. Transform healthcare delivery and community health. The ability to get folks connected. There has been historically a lot of work that gets done at a local, regional level to try to connect information, and the standards and the ability to work together more closely now is starting to improve and starting to reduce some of the silos that exist today. And certainly their goal is to foster research, scientific knowledge, and innovation, and enhance nation's health IT infrastructure. And as we get into some of the components of where healthcare is going, you'll see that FIDO stands in a very good position to help what I consider really open up the valve of information and let information share among partners in a way that they know that the person on the other end is that person, and they are able to share that information and help make a difference for folks. Andrew talked earlier about this is a good time for this webinar because HIMSS conference, their national conference, is next week in Las Vegas, where there are anywhere from 30 to 45,000 attendees that will embark upon Vegas on Monday and depart on Friday next week. I think it was this past summer or fall, they recently went to DC, and they had 3 congressional asks. One was to support robust interoperability and health information exchange. 2 is to expand access to telehealth services for Medicare beneficiaries and support healthcare's efforts to combat cyber threats. So let's talk about a use case. I think it's important that when you think about healthcare from your own personal experience, where could FIDO help? And what I want to talk today about is patient access to immunization records. So the universal questions are, where are my family's immunization records? What immunizations do I need? And why can't there be one place to get these records? What happens today is every time you get a shot, that gets loaded up into the state registry. And the ability to have bidirectional sharing of that information from pharmacies to physicians and through their EMRs and through their point-of-sale systems, as well as back to health plans, are important. So there is actually a consumer access to public health immunization information systems. They're called ISSs or IISs, and there is the ability to take what's happening today and improve upon it significantly through a FIDO use case. So let's talk a little bit more about that. There's a public health immunization information systems. Again, that's where it contains patient immunizations that are either given by physicians, hospital staff, pharmacists, employer clinics. There's a lot of push these days to help improve the hit rate, if you will, of employees taking their shots in advance. And there's meaningful use requirements for providers to be able to have the access to the information. Meaningful use is a program that was put together that identifies some key metrics for physicians to be able to perform so that they can get reimbursed. From a example perspective, there's an organization in Scottsdale, Arizona called Scientific Technologies Corporation, and they have a app called My Immunization Report. It's really a record for the family. It forecasts when immunizations are due, and it provides a certified state immunization report. So a good use case would be, it's the end of summer, mom's getting ready to get the kids ready to go back to school, and if they have any student athletes, they're going to have to produce a certified state immunization report so that can get submitted to the athletic director. We're going to walk through a little bit about what happens today and where it can move forward tomorrow. So today there's a process that the ONC, which we talked about before, has been testing in 5 states where they authenticate and access through a registry. So you register online, and then you go to your physician, because they're really the only ones that can identity proof you and sign up. And then ultimately you have to remember your password for access. What's interesting from a password perspective is that it's a bit of a, through the identity proofing component, there's been a low uptake and some unhappy users. And what's happening is, if you think about any password that you've had to remember, when you use something like this, where you're maybe getting this state report for your children to send to school, you're doing this once a year. So the ability for you to remember and to use this going forward becomes a bit of an issue. So going forward, the ability is to register online, to be doing identity proofing online, and then leverage the FIDO Strong Authentication to be able to access that information, which will help increase the uptake and help empower users. So if you go to the next slide, we're going to talk a little bit about where FIDO today, from the specifications, either the UAF or the U2F, along with the newly FIDO certified certifications, and the partnership with Knock Knock Labs, has the ability to leverage a device. So, leveraging what we've all heard in FIDO presentations before around either face recognition, fingerprint, voice, the ability to let the device be the tool, the ubiquitous tool, to be able to leverage this immunization process. And it's using the same standardized protocols, which leverages the local authentication to unlock the app that's specific for the key, and the keys used to authenticate the server to be able to share that information. So again, from a FIDO-enabled MyIR through Scientific Technology Corporation, they are able to ensure customer engagement. So if we're getting the ability to make it easier to have access to your information, and you feel comfortable that your information is being shared appropriately, and you can delegate that appropriately, there's a lot more that can happen besides just printing that immunization report. Now there's the ability, and now that you've got that linkage, going back to some of the trends in healthcare around patient engagement, there's alerting and notifications. There's area outbreaks. There's the flu near me. There's immunizations due that can be measured by the benefit design, which means maybe there's new vaccines or there's age-appropriate rules that need to be followed, and location of vaccines as well when you're traveling. And you need to be able to access that information across different states. And then also the ability to add patient data from other healthcare data sources. If you have prescription information and lab results, you can have patient credentialing and diabetes awareness programs, other disease state management programs, and certainly some chronic disease indicators. The important case here is that this really unlocks an opportunity in healthcare. We talked about the basic use case of being able to make the MyIR, my immunization report, easier to log in and pull down and leverage the technology that literally is in your hand with your phone. But the ability to get that connection and to know that the trading partners in these organizations, the health plans like Aetna that are working with health systems, that are working with EMRs, that are working with pharmacies, have the ability to leverage that strong authentication and to be able to delegate to appropriate care providers, whether that's physicians or moms or daughters that are taking care of parents. Those are really good examples of how this can start to unleash the sharing of information and change where we need to be going from a healthcare perspective. And that's sort of removing the quantity business model and moving over to the quality business model, which is really all about preventative healthcare and wellness and getting the patient involved so they become more of a consumer of healthcare. And with that, I thank you. I'll turn it back to Brett for a Q&A session.
Thank you, Tom. I think you covered a lot of ground there, and we do have some questions. Before I launch into questions, I just want to also point out that we have put some information in the chat box that is about where FIDO Alliance is participating at the RSA Security Conference next week. I think our relationships in healthcare are forming, so it's unfortunate that HIMSS and RSA Security are happening at the same time. So there isn't going to be a lot of FIDO presence at HIMSS. There's going to be more of a FIDO presence at RSA Security next week, starting with the Nonprofits on the Loose reception on Tuesday night. So there's now a link you can follow to register and attend that. Now let me get into some of the questions. So are there any plans to update the FIDO specification? That was one of the questions that we received. And let me put that, I'll take that question for myself and put that into some context. So when you think about FIDO technical specifications, you need to make sure you understand that that's a plural. There is more than one specification that has been produced by the FIDO Alliance. We have delivered the 1.0 suite of specifications in two families. The first specification suite, Universal Authentication Framework, or UAF, that supports use cases such as the one Tom showed in his diagram, where you're using a device that has local authentication capability, like a biometric sensor. It could be a PIN number that's just local to the device, and then that in turn would authenticate you using public key cryptography to a remote server, thus becoming the complete credential that you need to authenticate. The other suite of specification we have is U2F, Universal Second Factor. This is a replacement for your second factor authentication. So you would still use something else as a first factor, like perhaps keep the password if that's better for your deployment strategy. And then you can add FIDO U2F as a second factor, now using a secure hardware token device. So those are the two different specification suites. And the answer to the question is yes, we are updating our specification as any standard setting organization would do. We add features and capabilities to both UAF and U2F. Some examples of that published recently are extra bindings for the U2F devices. When we first published that specification, the U2F security device would only work over a USB connection to the host device. And now those devices can work over NFC and Bluetooth, making that a mobile solution. So we are always making updates to the specifications. In addition to that, I will reiterate what I mentioned earlier about FIDO 2.0. So we developed some new specifications and put them straight into the W3C. We call that FIDO 2.0. These were designed to be optimized for platform implementation, so operating systems and web browsers, so to support all the use cases previously supported in 1.0. So being able to meet those use cases that UAF meets and being able to meet the use cases that U2F meets, support for that in 2.0. So we are making updates as we go. So hopefully that answers that question. The next question I wanted to take, I'm going to direct this one to Tom. So Tom, you covered the congressional asks from HIMSS, to one of them being help us combat cyber threats. Could you say more about what Congress can do, what we anticipate? Let's say Congress responds positively to that request. What do we think that looks like? And where does FIDO fit into that?
Yeah, that's a very good question. I think Congress can come into play on a couple of venues. Certainly from a legislative perspective, and within that legislative perspective, a funding perspective. So From a federal and state perspective, there's an ability to leverage federal legislation that can support a nationwide effort. There are certain times that things have to be handled at a state level that sometimes supersede federal, believe it or not. And so there's an ability to, from an awareness perspective, get them educated on this piece. I think the big piece that is important is that they're finding ways to leverage funding opportunities and penalties that would allow the healthcare industry to support a much stronger component. And I think the other thing that they'll be able to do, if you think of, when you think of DC or you think of Congress, you've got you've got a group that can legislate, but when you think of state employees or the Medicaid population, the state and federal government are spending lots of dollars from Medicare, Medicaid on fraud, waste, and abuse. And the ability to put the right legislation in place to support technology versus some of the components that are in there today. A couple of years ago, former Speaker Newt Gingrich was talking about one of the states mandating that technology couldn't be used. So some of the legislation that gets put in place can be counterintuitive. So leveraging the tools that we have in place and getting them educated on components like FIDO Alliance will put them in a position to understand that the world is changing. There are other tools that are out there, and the ability to remove paper and leverage technology and not be afraid of it is areas of where I'm sure HIMSS is trying to do that. And we should be getting certainly a bigger update next week at HIMSS.
Great, thanks, Tom. Next question, I'm going to kind of let us share. So this is a question about, I'm going to take a couple questions and combine them. There's a question about, are you envisioning only UAF use cases, or are there also use cases with MyIR applications and what's happening around health records where you could see FIDO U2F being supported? That's the first question. And the second question is, because FIDO only addresses authentication and not identity proofing, what are your thoughts about how identity proofing is going to happen, specifically in the MyIR application?
Yeah, I think again, there's well, a couple things from the identity proofing component. The ability to have people from a walk-in capability. There's been a lot of use cases that works pretty well. So having both to be on-site and off-site from identity proofing is something that needs to be there, because a lot of people say, hey, we've got a trusted physician that's known, and they can authenticate the patients that come in. At the same time, with MyIR, if I'm a mother or a father and I just want to get the immunization report for my children, having to go in and set up an appointment just to be able to do that makes no sense. And so, having to have both is something that's important, and there's certainly a lot of tools and organizations that can support identity proofing. From let's talk about a use case scenario that can use both specifications. Let's take electronic prescribing. Electronic prescribing is the ability to identify who the patient is, identify where their payer is, get patient-specific information around formulary, benefit information, and medication history, and get that in the hands of physicians. So there are networks out there that support that capability, and the ability to do that and leverage the movement of information works very well. Now, in cases where the prescribing for controlled substances, that's a different story. The requirements there do require a two-factor authentication, and it's a much stronger proving process that takes place today. And although that is in place, it is still a bit early on where electronic prescribing of controlled substances is taking place. But that would be a good example where both of them would be in use in supporting those two use cases.
Yeah, thanks, Tom. And so just to summarize, I think the key there is where in the rules or guidance does do the regulators specify multi-factor authentication in the healthcare sector? And the FIDO Alliance is positioning both UAF and U2F as solution components for multi-factor authentication. So with U2F, clearly there's already a first factor, probably a what you know, like a password, and then you have this what you have second factor with the secure device. And then in UAF, we're also saying that if you're using either what you know, like a local PIN number, or what you are authentication factor, like a fingerprint or a facial recognition biometric, that also should be recognized by regulators as a multi-factor authentication event. And that we're also, it's our position that using biometric authentication in that way is very privacy preserving. Not only do you get the usability efficiencies of biometrics, you get your multi-factor authentication, multiple factors of authentication through biometrics. But third, what the FIDO architecture offers that's unique is that if you use it in this manner, then the personal biometric information actually never leaves the device. So it has that privacy upside as well. So I think we've answered that question. We're getting a number of other questions now. One is, do we see a path for recommendation for FIDO certified solutions? Like, how do we get to FIDO certified solutions becoming an industry best practice in the healthcare market? Is this something that we need to go and speak directly to regulators about to kind of get them to write it? What is in the realm of the probable in terms of how far a regulator would go in recognizing a specific technology like the FIDO standards? Or is this more working with trade associations like NHISAC and HIMSS? Tom, what would be your recommendation in terms of the most efficient path to seeing kind of game-changing recognition and guidance around, this marketplace embracing FIDO as sort of a pre-blessed technology to achieve that multi-factor authentication?
Yeah, that's a very good question. I think I'm going to go back to the use case around electronic prescribing. That was a good example of where there was a public and private push to drive what has now become electronic prescribing across the country. So in this case, I think from a public perspective, the ability to work with the government, educating legislators, some of the work that FIDO is already doing, certainly making sure and understanding where NIST fits into the situation. And you've already had some initial dialogue with ONC. ONC is always looking for, and it's been outlined in that slide that I had, new innovations and new standards to be leveraged. And those would be, from a government perspective, a couple of the key strategies going forward. What's interesting about the government is they can help drive and guide healthcare, and they've continued to do that throughout time. In some ways good, in some ways not so good. The reality is, if you, from a federal and even from a state perspective, if you're working at a state level and you're trying to drive change through some new innovation or new standards, it's interesting that a state organization can get behind it. And what they end up doing is they end up convening the private sector and getting the commercial health plans involved in doing that. And when it comes time to execution, it's interesting because a lot of the times the private sector can move far more swiftly than state and federal, which is good. And the reality is, if you take scenarios from a convenience perspective, like this MyIR, or you look at fraud, waste, and abuse and say, hey, if we leverage this technology, we're paying pennies to save dollars. There's a great ROI opportunity in that regard that can be shared, and that ends up being a bit of a push-pull between the public and private sector. And ultimately, when organizations start seeing that there's either dollars being saved or quality of care goes up, and in a lot of cases it can be both, it's easier to help drive that from a market perspective. And certainly working with the organizations like you had mentioned earlier, and certainly next week with HIMSS, they can be a great partner in that whole adoption process.
Thank you, Tom. I'm certain our working groups in the FIDO Alliance will be continuing our outreach and building more and more partnerships to help bring about those recommendations, establishing FIDO as a best practice. We do have more questions, so moving right along. There's a question about when do we believe FIDO will be W3C compliant, and what I would rephrase that slightly. When do you think the W3C will ratify the web authentication specifications that will be coming out of the new web authentication working group, which is meeting for the first time next week? To make a long story short, because W3C, they have many different steps in their process before, starting a standards initiative and concluding a standards initiative. We believe that if things move quickly through that process, and by the way, we anticipate they will move quickly through that process because there's already so many stakeholders that have worked on and basically already approved the specification set that work group is starting with. We think that it'll be summer of 2017 when the W3C is most likely to kind of ratify those specifications at the final stage. Now, don't confuse that date with when could I take advantage and build implementations of those specifications, because the FIDO2 specifications that we just published and put into the W3C, they have the same status from the FIDO Alliance's perspective as the specifications with FIDO 1.0, UAF, and UQF. So we don't yet have a FIDO certification program to support the adoption of 2.0, but what you could expect is that the FIDO Alliance will start to do FIDO certification testing and certifying of implementations to 2.0 based on the 2.0 specification set that we've produced. We are not intending to put all of that work into a big pause and wait for the W3C process to finish. We're participating in that process, but in the meantime, we do have companies that want to take advantage of some of those things, and we would love to see those specifications getting into web browsers and operating systems as soon as possible. So I would say we will start to see support from the FIDO Alliance, those adoption programs I mentioned, supporting FIDO to before summer of 2017. So that was a question I think it was pretty much directed at me. Next question that I see is, how do I get help adopting FIDO specifications? Perhaps Bree, who is managing this webinar for us today, maybe Bree could go find the right URL from our website, but we do run a public developer forum called FIDO Dev. I mean, it's a Google group, FIDO-dev at FIDOalliance.org. And this is a public group. Anyone can subscribe to this. And this is our public discussion forum to handle, technical questions and really probably any other questions, but really is for developers and implementers to talk to one another about, implementation best practices. The FIDO Alliance sort of stops at the standardization phase, and then we do testing and certification. So you have FIDO Dev as a public forum where you can ask technical questions as you're implementing these specifications. You might be able to use that forum if you're looking for, let's say, a consultant. I mean, maybe you could ask that question there and probably get a lot of responses. The other path forward is you can go to our list, again, on our website of FIDO certified implementations. We now have over 100 different products that have been tested and certified as being compliant to FIDO. That covers both UAF and U2F. And you can see all those companies there and know, okay, these are the companies that are implementing it already if what you're looking for is a kind of off-the-shelf implementation to deploy. The third thing you can do is you can join the FIDO Alliance and participate in our deployment working groups. So we have a deployment at scale working group, which is designed for online service providers who want to deploy and take advantage of FIDO capabilities to get together and share their kind of go-to-market requirements. These are the challenges we have. What's the best way to drop FIDO into our roadmap? And it's really, you'll find a rich set of peers to discuss those issues with, lessons learned by those who have deployed before you. And there's also an enterprise group specifically focusing on all those same questions, but for IT departments, rolling it out for your own employees. So those are just some of the ways that you can get some help rolling out FIDO. Tom, do you want to add anything to that in terms of from a healthcare perspective?
I think, again, identifying, and I'd be happy to work with anybody on this as a follow-up, but just identifying some of the use cases and identifying the ROIs and putting some best practices or some pilots in place is a great place to start that process in healthcare.
Yeah, excellent. So I'll move on to the next question. We have 5 minutes left, so I encourage you to keep typing in your questions if you have them. I think this is the last one that I have in queue. So this is the question is there already a healthcare working group in the FIDO Alliance? Which I think that's a great question. I'm surprised we didn't cover it before. So we do have a group called the Marketing Working Group. Really think of them as the adoption working group. That's their mission. How do you best educate the market about FIDO, what it can do, who has done what with FIDO so far, and how do you articulate that and bring that message to everyone to get scale as soon as possible. So this marketing working group has formed a subcommittee which is dedicated to healthcare, and our good friend Tom Groom here is the chair of that subcommittee. So Tom, do you want to add anything about what if someone from healthcare wants to get involved with FIDO, or maybe this could be a question from an existing FIDO member who wants to now be more involved on the healthcare adoption work? Can you give a few minutes and kind of tell us about what that group might be able to do in 2016?
Yeah, if there's anybody that's interested in getting involved, we would definitely like to hear from you. We do have some folks that are part of the FIDO Alliance, but as we get more healthcare folks involved, like we got Aetna involved, we would definitely like them on the healthcare subcommittee. There's more awareness, and we just need more people involved that we can have a bit more on the strategy side as well as feet on the street, being able to communicate and get folks like Rhett and others connected to some of the, whether it's the associations or some of the work that's being done in DC.
Thanks, Tom. I got 2 more questions in. I'm going to try to get them answered in the 4 minutes we have left or so. So the first question is, do you need to be a member of the FIDO Alliance in order to use the specifications? So no, not at all. In fact, one of the pages on our website is kind of about trademark use for companies who are not members of the FIDO Alliance. And if you wanted to put a FIDO login button on your website, for example. So we fully embrace that model. So there are 2 ways of doing this. One, if you are looking to deploy the FIDO solution and you work with a vendor who is a member of the FIDO Alliance, that is the most typical pattern that we expect to see. If you are writing your own implementation of the FIDO specifications, there are reasons you might want to be a FIDO member in terms of intellectual property rights benefits you get by joining the FIDO Alliance. So again, that is if you are doing the implementation yourself. You're not using a vendor solution or a partner solution. then there are reasons you might want to join the FIDO Alliance, but it is not a mandate. It's not required that you join the FIDO Alliance. And the third question, or the third part of this, relates to the second question I received in the past couple minutes, which was, can you build, or are we seeing people build solutions based on FIDO specifications for the enterprise? Are they building it themselves, or is everyone who is looking at this from a CIO perspective choosing vendor solutions? And I would say it's a little early to really know exactly where that market is going. I can say that from a business to consumer deployment scenario, we've definitely seen examples of both. Online service providers who have decided to build their own implementation from scratch, in compliance with the specifications, and then other examples where they have chosen, the buy instead of build decision, and they have gone with FIDO certified vendor solutions. In the enterprise, so far, I would say I've only seen solutions where you're going with a previously FIDO certified vendor, but there may be some enterprises out there looking to build their own implementation from scratch. I haven't seen that yet myself. So I think that brings us to the end of our time. I'll turn it back to Andrew to kind of wrap us up and talk about next steps.
Thank you, Brett, and thank you, Tom, and thanks everybody for joining today. We will have an archive of the webinar available on our website, so you'll be receiving a follow-up email with a direct link to that. And should you have any further questions, please contact us. We have a variety of contact mechanisms available at FIDOalliance.org, and we'll look forward to your participation in future webinars. So thank you very much.